this time. How does the US bring in AI to support education for K-12 and universities? It would be very insightful to learn from your experiences, and perhaps we can bring them into Pakistan.
Now, the speaker prior to me really touched on something that I thought was interesting, and that is that we do have an enormous amount of untapped data at these universities as well as preschools. The important aspect to that is getting access to that data is not as easy as one thinks. Of course, there's a tremendous number of laws within the US, European Union, etc. Our approach is to sort of take what we would call a mixed method approach, and that would be to look at it in terms of getting AI into the hands of the students, to the faculty, to the staff. Positively guide them, positively encourage them, while simultaneously looking at very specific ways that will have greater long-term impact. See, the problem with universities, as well as research, is oftentimes universities are slow to adopt new curriculum, new courses, new degree programs.
Well, actually, I spent a few years working in the United States. After that, I went back to China, and I noticed, I became aware that the Chinese government is spending a lot of money supporting universities and colleges.
Bismillah ar-Rahman ar-Rahim, and Assalamu alaikum. Good afternoon to everybody. Thank you so much, Shafi, for the invitation, for the opportunity, and for asking these questions. No doubt, the future is AI, and whether it's health or education or whatever, I think all sectors will be using it increasingly. If we think of digital innovation, I think after Windows and smartphones, we do not have feedback mechanism. We don't even know the facts and figures. Very few studies have been done, and that also more or less post studies. Their quality is what. So if you talk of evidence-based intervention, you need robust data, because otherwise, whatever the building is built, it is going to go to waste. The computer literacy is very low, especially in our frontliners like nurses, paramedics, doctors also, but less. They are still, about half of them can use computers or smartphones. So with that in background, since I was the Vice Chancellor many times, founding Vice Chancellor of many universities, I worked with Kunming Medical University in China, very closely. I keep going there and on. To overcome this acute human resource dearth on the technology side, I started in both the universities which I was Vice Chancellor, health informatics as a program. Because I feel that health is a different ballgame altogether, where it's a matter of life and death and minimizing the misery. So it must have a human angle. So that is why I wanted my doctors, nurses, paramedical to take up this as a profession, health informatics. And out of that, one big module is care. So once our hospitals, clinics, if you ask me how many are enabled like HMIS or technology enabled or digital record system, they know no more than 7%. So
for Econ Group, there are like lots of good news that as a Pakistani we are here, betterment in healthcare in the US, and we are using the teams in all the development units in Pakistan. And the doctor also talked about evidence-based decision support system. This year, as Safi asked, this year due to AI, the US healthcare CMS not only passing all those electronic health record system, which do evidence-based decisions, but it needs to be do predictive-based decisions also. And we are the first one, like most of the Asia are doing this one, but we are the first one which completed that certification 2 months back. So predictive-based, the evidence-based decisions use the data of the patients, and it provides you that okay, with this data, this person need to be given this medication, or it need to be treated like in that manner. But with the predictive-based decision support, it will use artificial intelligence, use machine learning algorithms, which will predict even before something is happened to that patient. And this is now becomes part of each and every electronic health record system in the US. And our solution is utilized by two of the doctor also talk about the how we can have all those outbreak and things. So our system used in two of the United States, Massachusetts states and Iowa states for those things. Okay. So this system is used from 2002 for all those purposes. So we have all those system available. Mainly thing is that how we can utilize it in Pakistan. The same thing for education. I know that Dr. Working in University Northeastern, they collect all the data from students, and then they know okay how some professors are working and everything. So main thing is the main issue that how we can collect data. In Pakistan, I think policies are not very hard and tough, so it's easier to collect data. But main thing is that how we provide those systems to education system, healthcare system, and people start using that system. Once they start using the system, we get the data and we can apply all those initiatives there. Same thing.
Essentially, AI, if you want to consider this, is algorithms that can process this data and make some inferences to do some complex tasks. So that's the basic definition of AI or machine learning, and that has been there ever since 1970s. In fact, this year's Nobel Prize in Physics that went to Professor John Hopfield and Professor Jeffrey Hinton for the work they started in 1982. And that led to these artificial neural networks that we use to solve these complex problems. Essentially, it was not just these algorithms, it is the associated technology, the infrastructure, the compute infrastructure. At that time, we didn't have that infrastructure, that's why we didn't see that manifestation of AI in those days. But now we have this compute infrastructure, these hardware and software that is available, which is making all that happen. So essentially, the progress that has been made, you can classify them as natural language processing. You can ask any question in natural language and AI would be able to understand that. Language understanding, machine translation, speech recognition, and generative AI. So these are the 5 or 6 categorization of the problems that AI addressed or solved. And these problems, again, there was work done in this area long before 1990s, 2000, but with the availability of that compute infrastructure, now these AI systems surpass human in addressing these problems. Now these problems, as we said, these problems exist in almost all domains, whether it's healthcare, education, business, e-commerce, and so on. So if we consider those, natural language processing, what we see here is you can develop a interaction with your customers, with your employees, answer their queries right away. You don't need humans, operators sitting there to interact with the user. You can pose any query, whether it's a hospital information system, whether it's a ticket reservation system. You have AI chatbots available to answer your queries instantaneously. Language understanding, you can ask any question in any language and you have the AI capability.
So the problem with ChatGPT is that you need to be computer literate. So if you're computer literate, you would be able to use ChatGPT. But if we look down the road, maybe after 15 years, 20 years, when we have a speech GPT, then you wouldn't even need to be computer literate. So you would have a mobile phone and maybe it'll have an avatar and you could talk to your avatar and you can do whatever you like. Now if we talk about ethics, so like there's ethics and then there is also competency and proficiency. So if we are using AI and we have this concern that if students start using AI to start writing essays, they will lose the ability to write documents, technical documents. If a computer students start using AI to write programs, they would be unable to learn how to write good computer programs, and so on and so forth. So maybe I think maybe that's how it was meant to be. Maybe that's how the future humans should be and would be, that they really wouldn't want to or need to perform calculus operations, or they wouldn't need to really know how to write good English, or maybe would be good programmers. And maybe in the end, all of these different areas, education, everything, that just combine to maybe having a one chat GPT. And maybe if you're a Chief Minister of Punjab, you could just tell that Chief Minister of Punjab, how can I make this thing go away? And maybe it'll just go away. So in my opinion, I think that all of these fields will eventually merge, and the ethical concerns that we have will remain. But I think that whatever I see will happen in 20 years, or maybe 15 years, or maybe in 30 years. But to get to that, we have massive opportunity right now, and we need experts and individuals in this area so that we can eventually get to that point. So you also talked about maybe how AI can be used to take care of the taxes, right? So the answer is always very simple. So how would a human solve that problem? And then you just ask that AI to solve that same problem in the similar manner.